Welcome back to Desk Careers. I'm so excited to bring another incredible guest. Today we are meeting with Hinda Daggag, who is the head of genetics projects for SIHA in Abu Dhabi. Welcome, Hinda. I'm so excited to have you with me today.
Hi, Maria. Thank you very much, actually, for the invitation. It's a pleasure.
I have so many questions, and I definitely want to jump into all of those things. But before we do, I'd like to take you down memory lane. Let's talk about the younger Hinda. I know that you were interested in languages and chemistry as a younger student, but when did you start to understand that the direction of medical health and practice, maybe not exactly what you're doing today, but when did you start to understand that, that's what it's going to be for me?
Um, well, that probably happened when I was about 20, I would say, or 21. So I've already been into maybe second year of university studying languages and philosophy. And I always thought that I'm going to be, I don't know, an interpreter or translator, working with big politicians or the UN or something like that. Like that's how I imagine myself. But then because biology in general and chemistry was something that I liked, and math just in general, I had general interest for it. So I just chose a subject alongside of languages and philosophy that had quite some focus on genetics. And it was just an elective, really. I thought, okay, why not? Go outside of what I've chosen as my majors, and that's really where it all started. And I just fell in love with genetics, and literally within, I think, 3 to 4 months, I decided to completely switch from languages and go into sciences, biology, and then major in genetics.
So I find that incredibly inspiring because I know watching this will be a young person who thinks if they don't make the right choice at 16, what is going to happen to me? And hearing what you're saying, you were 20 when it all kind of came together. How do you respond to that concern that a young person might be feeling?
I think, the society and us kind of putting a lot of pressure on ourselves and our parents. And, I think there's a lot of pressure coming from different sides that kind of pushes us in that direction of, oh my goodness, I'm 16, I should know by now what I'm going to be and, what am I going to major in. And I would like to think that I'm a good example that does not necessarily always have to happen. Yes, sometimes it does, and it's great. Sometimes people from when they're like 10 years old, they know what they're going to be and they really kind of pursue that. But it's not for everybody, and I really don't think that we should live under that pressure. And sometimes when you're exposed to different fields and different subjects, that's really what makes you kind of understand who you are or who you want to be and what do you want to pursue. So I hope that that's kind of how the students will be seeing it.
I think it's so important. And what I'm hearing you say is adaptability, being ready to make those changes and not listening to what you think you should be doing, but really just trying to find what is interesting for you, like you did, and also be okay with making those changes. I do also think that's very important. Now, Hinda, someone like you working for the largest government healthcare provider in Abu Dhabi, what is it that you really think, what, if young people could understand what I do, this is what I want them to remember about my work?
Um, Look, I mean, I would like to think that it's mainly about giving back to society. And I know we all choose our different ways of doing that. And I have chosen to do that by working in the government sector and moreover government healthcare sector, so I hope that what they can really take out of it is that whatever they decide to do in life, to look at it from the perspective of how can I really be kind of a contributing member of the society, and what can I give to others. I hope that what I have chosen also, that in one way or another, I am giving something to society. So I would like also the young students to try and think that way, to think not just about themselves, and what they want on a personal level, but something a bit wider than that.
I think that's so, so important. Now, let's talk about your current role. You described it as a role that focuses on mapping the landscape of genetics and genomics in the SIHA healthcare facility. You said there are many hospitals and outpatient clinics, and you're responsible for devising a strategy on how to centralize, expand, while keeping patient-centric approaches. What does that mean for a young person that might not really understand?
So, I mean, let me kind of give a little bit of background in terms of genetics overall, or as a field, so that students also can have an understanding of the different variety, really, of how wide this field is. So, although I am where I am right now, I really started from a scientific background. So really by my background in terms of university, I'm a scientist. I did a PhD in human genetics, fully based in the lab. And basically after doing that for 4 years, doing the PhD for 4 years, decided that the lab is not for me. So yet another example of how things change. That does not by any means mean that what I have done and the time that I have invested was a waste. Absolutely not. But I just chose to really get out of the lab and try something else. And so I've even been managing a diagnostic lab, so testing for genetic conditions. And again, I wanted to diversify, and then I also went into genetic counseling. So I did some kind of basically just upgraded my education to be able to also practice as a genetic counselor, and then ended up in corporate SAHA. So I am not in one of the hospitals. I am not dealing with patients directly. I work on the overall strategy of the genomics field for SAHA as a healthcare provider. So, it's many different directions that it can take you in, and as long as you have some sort of a foundation, you later kind of pick, where you want to go.
There's such a clear pattern of you adapting at every stage. So I heard you say when you were younger, and then you did it again at a PhD level. I mean, you don't just say it's okay. You actually have done it. You've adapted. What were some of the signs that you were able to tap into that made you understand, you know what, I'm going to put my ego to the side, this idea that I did my PhD, and I'm really going to make myself understand how am I going to be happy in my career? What were some of those deciding factors that you think young people should really pay attention to?
Look, I would like to believe that one of the biggest is really self-awareness. So it is the continuous check-in between you and yourself. So every decision that you make, you sit down with yourself and you just kind of, internalize, let's say, that decision to try to understand whether it came from the right place, or did it come because of certain pressures or because of certain stereotype, or, whatever it may be, because I think it needs to come from that right place. And I think it's very, very important for us to understand who we are as individuals. And that comes with understanding our strengths and understanding our challenges, our weaknesses. I mean, we're all humans, it's okay, and then making the decision whether you would like to pursue where your strengths are, or whether you're interested in something where you have certain challenges, and then you will put in more effort to work on those challenges to actually be able to do what you want to do. So for me, like, I look at the career path or your professional life, I always look at it more from a personal lens. And I think that is the most important element, that, you look at it as an individual rather than anything else.
So important, so important. On the topic of gender, would you say that your field is balanced between the gender, or is it heavier on one side of the spectrum than the other?
I think if we kind of look at it from the practical side, so if you walk around different research labs or different healthcare institutions and have a look, who are the people who are practicing genetics in one field or another within the genetics overall scope, it's probably more females, actually. I believe it is more female oriented. Now, the reasons behind it, I don't know. It is possible that it's something that in general females are more attracted to when we are talking about that nurture and protection, and because genetics is quite a lot about that, where you're in touch with the patients quite a lot of times. So maybe that's where it comes from. But I would say that I would see more females in the field, even in the lab or as a genetic counselors or as clinical geneticists. Overall, it is a little bit more females, I think.
Fantastic. Okay. So now we're going to zoom into what it means. Let's talk about genetics. What is genetics? So for a young student, our students are ages range from 12 to 18. So for a young person that might have never heard of genetics, but really are interested in this conversation and want to learn more about it, can you define what genetics is and how it shows up in a career? Like what do we focus on when we're talking about genetics?
So to put it in kind of simplistic terms, I would say that genetics is in the essence what we are made of biologically. So you basically, it is your makeup, literally, of every single living cell in your body is carrying your genetic material. And that's what makes us us. That's what makes us different from each other. That's why each individual in this world is unique, because of our genetics. But then when we say also we are unique because of genetics, we are also so similar because of genetics. So it is the genetic machinery that basically produces all the proteins that our body needs to function in the way that we do. And nowadays, genetics, the emphasis on genetics is so much more than it used to be, because we understand it much better, because the technology has advanced so much to help us to be able to understand it and to understand the importance of it, especially in the medical field. Let's say in the medical field, and with the medical field comes obviously research and innovation. So that's kind of to put it in simple terms, I think.
Wonderful, wonderful. What would you say are some of the most interesting research projects happening right now in the region or maybe globally?
Wow. Well, probably, let's say, I mean, in terms of the amount of research that happens, it's like absolutely, it's infinite, because literally anything that is related to us humans, human body, human disease, anything, our height, our color of our eyes, any conditions that we have, you can go into it and study it a bit further from the perspective of genetics. But if we talk about countries, let's kind of, zoom out. Probably in the last 10 years, I would say, everybody has been focusing on doing huge population-based genetic analysis. So basically reading the genetic makeup of individuals in different countries. And what's very interesting is that the UAE has embarked on such a project also. So I think maybe some of the students would have heard about it. It's called the Emirati Genome Program, and it's a program that was launched, I think, in the late 2019. And the idea behind it is really to genetically read every single Emirati individual in the UAE and then utilize, that data, that information for many different purposes. So I would say probably that's kind of where we are right now, those large population-based genetic studies.
What has your field learned through this past pandemic, through the pandemic? I mean, it's still ongoing. What is the field of genetics really learned through this experience?
Well, I think it's fair to say that if we did not advance in genetics the way we have, that really because of genetics, we were able to manage the pandemic the way we have, because in order to be able to create or develop a vaccine against any virus, you need to be able to understand the genetic makeup of that virus, and that is done through genetic technology. So if we did not have genetic sequencing, which is what was basically utilized, we wouldn't be where we are now. The pandemic would have lasted for much longer. The vaccine would not be here. So it's, when you think about it from that perspective, it's absolutely amazing what genetics has kind of done or contributed to, at least.
So when we talk about genetics, there's a lot of ethics involved in the work, I'm sure, that is done. What are some of the laws or government restrictions that you've come across in this work of genetics?
Look, I mean, each country has different sets of policies and regulations. Obviously, they need to be customized to that specific society, culture, traditions, and many other things. So you're absolutely right that there are a lot of ethical dilemmas when it comes to genetics, and this is something that it's a constant, something that would always be there, and something that we always have to think about, especially as the technology advances even more and we can do even more with genetics. The UAE has been really great in kind of putting all the necessary, let's say, checkpoints for the field of genetics, because they are getting ready, because they know, the amount of data and information that's going to come out of these kind of huge studies that they have just embarked on, that they need to have these checkpoints. So whether that is about the patient confidentiality and anonymity, whether it's about the data itself and the privacy of data and who can look at the data or who can it be shared with. So, there are many different perspectives that you need to kind of take into consideration. But I think, they've done a really, really great job here.
Amazing. What about the advancements of cancer research and genetics? Has there been anything that you think, it's really important for us to recognize that the work, the research that we put into genetics has really come through in this cancer research?
So I'll tell you something, cancer is not my field. I have a very limited knowledge in basically really what happens with the technology and in general in the space of cancer genomics, because it's a whole field on its own, literally. You have to spend years to study it. But just like we've seen in other fields, definitely the cancer field has seen a huge advancement when it comes to genetics and the utilization of genetics to identify specific mutations that patients might carry, to catch it early on, to be able to then manage clinically, change the management of these patients. I think just recently also there was in the UK, I believe, a new approach to basically detecting cancer. So now from a simple blood test, they can detect, I don't know how many, more than 50 different cancers or predisposition that you might have, so that it will be caught so early on that you can immediately intervene and do something about it. So, I mean, it is just kind of mind-boggling where we're going with all of this.
I'm listening to you, and you are just so, it's like you're breathing. You can tell that this is so your field. And any young person watching this right now, other than the amazing things that you're telling us, what I would like them to walk away with is whatever career they do, they should be really exuberating this vibe that you're giving off right now when you're talking about your specialty. Do you ever go home and think, wow, what a day? Like, my day was just absolutely incredible. I can't imagine doing anything other than this work in genetics.
In all honesty, absolutely. I have days that are like that, and I have days that are the opposite of that, where I also go home and I go, oh my goodness, I cannot see enough kind of results. I need things to happen quicker. I don't know if I've done a good enough of a job. Have I chosen the right thing to do? So, even you will always have the good days and the bad days. But I think at the end of the day, what is most important is like when literally at the end of it all, when you think about whether you have chosen the right path or the right path for you, if there is passion for it, if every time that you get asked the question or discuss your field, you feel these butterflies kind of in your stomach, then you know that you have done the right thing. You have chosen the right thing for you. And there will always be ups and downs. And there have been ups and downs throughout my career or in different companies that I've worked with, but there was never a question about whether I'm doing truly what I love, because the answer was always yes.
So amazing. I'm going to dip back into some of these more specific questions. I know that our science teachers are really keen to let our students understand. What would you say are the most common genetic diseases geographically, if we're looking at it here in the region?
So in the region, there is quite a lot of blood disorders, to kind of simplify the terminology. And I think maybe something that quite a lot of us hear about is thalassemias or sickle cell anemia. So these are specific to the Mediterranean region area. So, and obviously in the Arab world or the MENA region, also due to consanguinity, so the marriage of cousins, that kind of also produces a higher incidence of genetic disorders, because the chances of the mutations, same mutations causing a genetic condition meeting together and creating basically the disease, they are much higher because of these consanguineous marriages. So I would say probably those would be the most common here, but there are many others.
Of course, there would be. So if we look at this specific one, how could one reduce the number of patients who would suffer from this disease?
So again, when we're talking about genetics, we need to be culturally sensitive, and perhaps certain approaches that would be used in Western countries are not appropriate to be used here. So if we are talking about this part of the world, and one thing that also the government in general seems to be thinking towards is, well, what can we do prior to marriage? So if people knew that they were carriers of a certain mutation, first of all, just having that understanding that this is your possibility, and these possibilities can be accurately calculated. So you can be told, you have a 25% chance of carrying this, or your baby will have a 50% chance of being affected by the condition. So doing these kind of things, so kind of moving more towards prevention rather than diagnosis. And then the second step, even after you do the testing prior to the marriage, again, due to the technology and the advancements in the technology, IVF, so in vitro fertilization, can be utilized. And within that process, the cells, that will be fertilized can actually be checked to see whether they carry specific mutations or not.
That's amazing.
So again, it's amazing what we can do.
Yeah, that's so amazing. What about genetic modification of crops? Is that a thing here in the UAE? And if so, what are some of the reasons?
I don't know much about it, in all honesty. I did hear that UAE government has a full policy on genetically modified crops, but I don't really know much about it.
That's fine. That's fine. Now let's talk about technology. What are some of the newest technologies that you've come across in the work of genetics that you think, if you're a young person and thinking about this, really start to learn some of this new technology? It's something that you want to be paying attention to.
So I think this is going to come as no surprise, because probably in most fields nowadays, regardless what you choose and whether it's kind of, I think it doesn't matter which field you're in, it's all about data. And we hear so much about artificial intelligence and, how you can kind of utilize huge amounts of data and analyze them and look for patterns and do predictions. And genetics is no different, really. So I think ability to understand data, and to look at it from a very different perspective is going to be useful for all the students, no matter which field they choose. I have to say, from a personal perspective, I struggle with it a lot. That has never been my strong side, looking at data and kind of computational approaches to data. But I believe it's not just the future, it's the reality of now, and even more so the future. So data, bioinformatics, that kind of field probably would be recommended for everybody as a baseline.
Amazing. I'm going to bring this to a wrap. I know we've asked you so many questions. When I think about your top 3 career tips, they're really inspiring. First, you said follow your passion. Everything you said on this interview, in this conversation, it felt so authentic in that you're very passionate about this work and it comes across. And of course, you said, there's some great days and there's some really challenging days. But what we heard you saying is you would choose it again and again because this is what you really enjoy doing. Tip number 2, you said, is to be ambitious. So how ambitious can one be in a field like yours? Because is there room for ambition, or is it really about structure and following protocol?
Look, I think you have to have a bit of both. And I always say this in life, regardless, as a mother, as a daughter, as an employee, as a coach, whatever it is, it's all about the balance. I think we spend our lives searching for that balance. And I don't think that it can be just ambition or that it can be just structure and organization. You need to really have it all, and you can have it all. You just need to work on it. Again, working on your weaknesses or challenges, and utilizing your strengths. And absolutely, there is space for ambition in genetics. It can take you really in so many different directions, but you do need to be committed. Again, no matter what you choose, what kind of career path you choose, you're going to have to be committed and you're going to have to work hard. Only a very, very few of us are very lucky to get somewhere without hard work. So I wouldn't want to take the chances, you know, I would still want to put in the hard work, but it's worth it.
It is. I completely agree with you. I completely agree. What was the highlight of your career so far? I'm sure there are so many that you're celebrating, but when you think, what was the one thing that you think, wow, what a moment?
Oh my goodness. That's a very interesting question. You know, I never thought about that actually, whether there would be anything that one thing that would really stand out, because I have kind of shifted in different areas within the genetics field, you know, that everything had its kind of own little bubble that I don't know. It's something that I would need to think about and maybe get back to you.
I love it. I can't wait to hear all about it. So many great things. Hinda, it has been such a pleasure talking with you today. I've really enjoyed our conversation. It was so insightful, very inspiring. And for a young person watching this, I don't believe they could have learned what you taught us today by sitting in a classroom. I think the perspective you brought into it, how you described it, it just made it all so interesting. So I thank you again.
Thank you very much, Maria. And I truly, genuinely hope that the students will be able to take at least something out of it. And if any of them are interested in genetics, they can approach me at any time and we can discuss it even more.
Wonderful. I'm sure you're going to have quite a few people knocking on your door. So
that's okay. We need more geneticists. So
I love it. I love it. And that brings us to the end of another incredible conversation. Today, we were speaking with Hinda Daggag, who is the head of genetics projects for SEHA here in Abu Dhabi in the United Arab Emirates. Thank you for watching, and we will see you at our next Desk Careers Digital Spotlight.